Atin naman tatalakayin ang COVID-19 situation sa bansa at iba pang mga isyong pangkalusugan with Dr. Ron Jean Solante, isang infectious diseases expert. Magandang umaga po, Dr. Solante.
Hi, good morning, Aljon.
Ayon sa report ng DOH, Doktor, mayroong 147 na karagdagang kaso ng Omicron subvariant sa bansa at 139 out of 147 ay kaso ng BA.5. Ano po inyo nakikitang indication dito?
Well, Aljon, BA.5 has been with us for almost 4 to 6 weeks now, in the Philippines. And it's the dominant variant globally. Most countries are reporting this from 70-75% of their positive cases. And this is expected sa BA.5 because this is the most evasive subvariant of the Omicron, particularly those who were vaccinated. So pwede ka pa rin magka-infection. For those who have previous infection, pwede ka pa rin magka-reinfection. And especially for those wala talagang bakuna, mas mataas ang risk na makakuha ng BA.5. No? And nakikita natin dito, there is a downtrend in the last week, compared last week. But if you'll notice, the downtrend is so slow. So ano ang indikasyon nito? Ang indikasyon nito is that there is still ongoing community transmission. And we cannot really say that we are off in terms of pwede na tayong mag-relax sa mga health protocols. Napaka-importante sa BA.5 is there are also descendants of this lineage na medyo mataas din ang hawaan, like the BA.5.1, BA.5.2 na nanganganak din siya, so which means that we're here, this variant of concern will be here for a longer period of time since most of us are vulnerable.
Bumaba sa 3,000 per day ang kaso ng COVID-19 sa Pilipinas. Sa inyo bang tingin ay ito'y magtutuloy-tuloy na ang pagbaba?
Well, I hope na maging consistent itong pagbaba, But again, as I've mentioned, since this is a highly transmissible and more people now are going out, especially with the implementation now of mga full face-to-face sa mga classes, then we would expect tataas ang mga kaso, Pero tandaan natin, more than 90% of this BA.5 are mild symptoms only, So which means that among the younger populations, talagang it's a mild symptom. Pero hindi natin ito masasabi doon sa mga matatanda, mga immunocompromised, because these are the people highly vulnerable, In fact, in the last report of the WHO, the Western Pacific region is one of 2 regions reporting increase in mortality. And number 3 doon ang Philippines, aside from Japan and Australia. And this mortality are also those persons who are in the vulnerable populations with a lot of comorbidities, who are elderly. So talagang natural, yung bakuna hindi sapat. Kaya napaka-importante ang health protocol sa mga ganitong klaseng hawaan ngayon, even when you are vaccinated.
Ayon sa latest projection ng Health Department, Dr. Solante, maaaring umakyat sa 9,000 kada araw ang COVID-19 sa katapusan ng Setyembre. Sang-ayon ba kayo dito sa kanilang projection?
Yes, I fully agree with that, Kasi nakikita na natin, na with this BA.5, ang tagal niyang bumaba, So there's also a possibility na aakyat na naman to, especially sa nabanggit ko na tataas ang mobility, tataas ang mga pagtitipon-tipon, sa mga iba't ibang forms of gatherings. At alam naman natin na itong BA.5 can still infect those even if you are fully vaccinated. So I hope hindi mangyayari yan because those are projections at pwede nating mapipigilan yan by allowing ourselves to get the first booster for the eligible population and the second booster to be given to protect against severe infection. Kasi maski tataas ang mga kaso, let's say 9,000, 10,000, there's always the possibility na tataas din ang ma-admit sa hospital. And among those that will be admitted are the high risk or the vulnerable population.
Kung mangyayari po itong projection ng Health Department na 9,000 cases per day, may posibilidad bang tumaas ang hospital utilization rate?
Yes, correct, no? Dahil if cases are going up, then there's always a higher rate of those that are in the vulnerable population na matatamaan ito, no? And the fact na yung vulnerable population are only less than 50% protected of getting the infection, but the risk of getting the more severe infection will be higher compared to those in the younger population. And that's why vaccine is part of that. And we need also to increase the access of antiviral agents that it will be very important for this population para kung magka-COVID man sila, they have enough protection that they will not go into severe COVID, and that will prevent also hospitalization.
Sa ibang usapin po, tumataas na naman ngayon ang nako-confine. Hindi po dahil sa COVID-19, kundi dahil sa tinatawag na wild or waterborne diseases. Ano po mga challenges na nararanasan ngayon sa mga ospital? Nagkukulang ba tayo sa mga staff ngayon, Doktor?
Well, in terms of sa hospital personnel, no, mukhang kaya naman. Particularly, I'm talking about most government hospitals, no, because our bed allocations are really very high for any of this infection, no. Ang ano lang dito, ang challenges lang dito na pag mas lalong tumaas, especially with dengue, with leptospirosis, no, and other waterborne infection, kailangan talaga na mag-allocate pa rin tayo ng karagdagang mga tao sa hospital to cater the needs of these patients. And dito tinuturing natin na mag-increase natin yung capacity natin, at the same time incentives, no, for the healthcare workers para naman at least they will not be going out and looking for other jobs. Napaka-importante ang mga healthcare workers at this point in time, especially with ongoing COVID, monkeypox, and at the same time with this wild infection.
May ilang nagmumungkahi naman na mag-lockdown matapos sa pagkaroon ng ika-4 na kaso ng monkeypox sa Iloilo. Ano po inyong masasabi dito?
Well, that's overacting, no, in terms of lockdown as an option for monkeypox infection. Ang current cases natin are not enough yet to say na kailangan tayo mag-lockdown. And we know that monkeypox is not as highly transmissible as COVID, no? So I don't think a lockdown is the solution. It's important to increase the awareness in these regions, especially kung saan ang monkeypox ngayon, in terms of the community, paano natin maiwasan ang monkeypox, ano yung mga common sintomas para ma-increase natin yung health-seeking behavior ng mga tao na mayroong ganitong sintomas, magpupunta sila sa mga doktor nila, para at least makikita ng mga doktor at ma-diagnose. And importante, kung ma-diagnose sila, they will also be isolated to stop the human-to-human transmission.
Nakikita ba natin na may local transmission na ang monkeypox? Wala raw kasing travel history yung ika-4 na kaso, Doktor?
Yes, it's too early to say na meron na tayong local transmission, no? But given the fact na itong pang-4 na kaso ay walang history of travel, then the likelihood of a local transmission can be there, no? At hindi tayo magpapanik at mas lalo nating paigtingin, no, ang mga protocol natin, especially sa mga hospital who are caring for these patients, na ma-increase natin ang detection rate, no, sa mga ganitong klaseng sakit kagaya ng monkeypox, no, because the more cases we will detect, then the more we can stop the transmission, especially with contact tracing. Napaka-importante ang contact tracing sa monkeypox because the incubation period and before the appearance of symptoms is quite high, long, no, 21 days. So you have time to do contact tracing before they develop the symptoms. And at the same time, before they develop the symptoms, they can also be monitored and quarantined. So At the level sa hospital, sa community, lahat sana magtulong-tulungan to increase the awareness, to increase the surveillance, and hopefully we can stop the transmission of monkeypox.
Mensahe o paalala na lang, Doktor, para sa ating mga kababayan upang makaiwas sa anumang sakit, lalo na ngayong tag-ulan.
Well, yes, at this point, no, panatilihin natin yan, maging healthy tayo at hindi tayo magkakasakit. Merong mga oportunidad na protektahan tayo sa sarili sa pagtanggap ng mga bakuna, hindi lang COVID, kung hindi COVID, pneumococcal vaccine, flu vaccine. And those who will be exposed sa mga baha, no, mag-ingat pa rin tayo dahil nandito ang leptospirosis, nandito pa rin ang dengue. So it's an important na priority, protecting ourselves and protecting our family.
Alright, maraming salamat sa inyong oras, Dr. Ron Jean Solante.
Thank you, Aljon.
Opo. Maraming salamat din sa mga healthcare workers natin, ang ating mga bagong bayani. Stay safe po, Doctor. Thank you.